Every one of us owes our existence to a mother. From the very first heartbeat to our first steps, mothers nurture, guide, and shape our lives in countless ways. Their sacrifices, both seen and unseen, lay the foundation for our families and communities. Yet, the journey of motherhood is not always easy. It is filled with challenges, uncertainties, and moments of profound strength. Motherhood is a journey of strength, love, and creation, one that deserves dignity and safety. Every mother, regardless of where she lives or her circumstances, should be able to experience pregnancy and childbirth without fear. The love a mother gives is boundless, and her well-being is essential for the happiness and health of her children. When we support mothers, we support the very heart of our society. Safe motherhood is not just a health issue, it's a human right. It means ensuring that every woman has access to quality healthcare, respectful treatment, and the information she needs to make informed choices. It means standing up for the rights of women everywhere, so that no mother is left behind or made to feel alone in her journey. Every woman should be able to bring new life into the world with full support from her community and healthcare system. This support includes not only medical care, but also emotional encouragement, education, and a safe environment. When families, communities, and healthcare providers work together, mothers are empowered to thrive. National Safe Motherhood Day reminds us of the risks mothers face and the solutions we can champion. Complications during pregnancy and childbirth are still a leading cause of death and disability for women worldwide. But with awareness, education, and access to care, these risks can be greatly reduced. We all have a role to play in advocating for better maternal health policies and practices. Across the globe, communities are coming together to break down barriers to safe motherhood. From rural clinics to urban hospitals, dedicated professionals and volunteers are working tirelessly to ensure that every mother receives the care she needs. Their efforts are a testament to the power of collective action and compassion. The health of a mother is the foundation of a healthy family, and by extension, a strong community. When mothers are cared for, they are better able to care for their children, nurture their families, and contribute to society. A mother's well-being ripples outward, touching everyone around her. When mothers are healthy, children thrive, families prosper, and nations grow stronger. The benefits of safe motherhood extend far beyond the individual. They uplift entire generations. Investing in maternal health is one of the most effective ways to build a brighter, more equitable future for all. Investing in maternal health creates a ripple effect, benefiting generations to come. Healthy mothers raise healthy children, who in turn become the leaders, caregivers, and innovators of tomorrow. By supporting mothers today, we are planting the seeds for a better world. Today, think of the mothers in your life and around the world. Consider the challenges they face, the dreams they hold, and the love they give. Let us honor their resilience and recognize the importance of standing together to ensure their safety and well-being. This day is for them, and for every woman embarking on the journey of motherhood. It is a call to action for all of us to listen, to learn, and to lend our voices in support of safe motherhood everywhere. Let's commit to building a world where every mother is safe, respected, and cherished. Together, we can create a future where no woman fears for her life while giving life, and every mother is surrounded by care and compassion. Safe motherhood is a celebration of life and a promise to protect those who make life possible. Let us honor mothers everywhere by ensuring their safety, dignity, and well-being, today and every day. National Safe Motherhood Day is a significant observance that began in India, a country where the journey of motherhood is both celebrated and at times fraught with challenges. This day was established to shine a light on the importance of maternal health and to ensure that every woman, regardless of her background or circumstances, receives the care and respect she deserves during pregnancy and childbirth. The movement was sparked by the passionate efforts of the White Ribbon Alliance for Safe Motherhood, a coalition of individuals and organizations dedicated to improving the lives of mothers across India. Their advocacy brought together communities, health workers, and policymakers, all united by a common goal: to make motherhood safer for every woman. April 11th was chosen with deep intention. It is the birthday of Kasturba Gandhi, a woman who stood as a symbol of compassion, resilience, and unwavering support for others. By honoring her, the day pays tribute not only to her legacy, but also to the countless women who have shaped families and communities with their love and strength. Kasturba Gandhi was far more than just the wife of Mahatma Gandhi. She was a leader in her own right, a mother not only to her children but to many who sought her guidance and care. Her life was a testament to the power of empathy and the impact one woman can have on the world around her. National Safe Motherhood Day was created as a response to the alarming rates of maternal mortality in India. It is a day to remember the mothers who have been lost, to stand with grieving families, and to renew our commitment to saving lives. It is a call to action, urging society to address the gaps in healthcare and to support women at every stage of motherhood. In 2003, India made history by becoming the first country in the world to officially declare a National Safe Motherhood Day. This landmark decision signaled a new era, where the health and well-being of mothers became a national priority, recognized and supported at the highest levels of government. This declaration was more than just a policy. It was a powerful acknowledgement that every mother's life is precious, and that no woman should face the risk of death or suffering simply for bringing new life into the world. It was a promise to mothers everywhere that their voices and their lives matter. The day transformed what began as a grassroots movement into a national mission. Across cities and villages, people came together to educate, advocate, and support one another. Health campaigns reached remote areas, volunteers spread awareness, and communities rallied to demand better care for mothers. Now, every April 11th, people from all walks of life unite in solidarity. They march in rallies, wear white ribbons, and hold events to remind the nation that no woman should die giving life. It is a day when voices rise together, calling for change and celebrating progress. National Safe Motherhood Day is more than a date on the calendar. It is a day of remembrance, action, and hope. It honors the love of mothers, the strength of families, and the promise of a safer, healthier future for women everywhere. The mission of National Safe Motherhood Day is simple, yet profoundly important. It is a call to action, a reminder that every mother's life matters, and that the health of mothers shapes the future of entire communities and nations. The goal is to save mothers and newborns, ensuring that every pregnancy is a journey of hope, not fear. When a mother survives and thrives, her child has a better chance at a healthy, happy life. Families stay together, and communities grow stronger. Preventable deaths devastate families and communities for generations. The loss of a mother is not just a personal tragedy. It ripples outward, affecting children, partners, and the entire social fabric. Children left without mothers are more vulnerable to illness, poverty, and lack of education. National Safe Motherhood Day advocates for better healthcare policies, increased funding, and well-equipped hospitals, especially in rural and underserved areas where resources are often scarce. It's about making sure that no woman is left behind, no matter where she lives. The movement pushes for more skilled doctors, nurses, and midwives, and ensures that essential medicines and supplies are always available. Access to quality care can mean the difference between life and death for mothers and their babies. Public awareness is key, educating families about the importance of regular prenatal checkups, skilled birth attendants, and recognizing warning signs early. When communities understand the risks and solutions, they can act quickly to save lives. Knowledge empowers women to protect themselves and their babies. When women are informed, they can make choices that keep them safe, seek help when needed, and advocate for their own health and well-being. The ultimate goal is to create a culture where mothers are valued, respected, and prioritized. When society celebrates motherhood and invests in maternal health, everyone benefits. A woman's death in childbirth is not fate. It's an injustice we can prevent. With the right care, support, and resources, these tragedies are avoidable. Every life lost is a call to do better. National Safe Motherhood Day is about respect, care, and changing mindsets. It's about breaking the silence around maternal health and making it a priority for everyone, from policymakers to families. When communities value mothers, they move mountains to keep them safe. They come together to build clinics, support health workers, and ensure that every woman has access to the care she needs. Safe motherhood is about joy, not fear. It's about giving every mother the chance to watch her children grow, to dream for their future, and to be celebrated for the life she brings into the world. India's National Safe Motherhood Day is a model for the world. Maternal health challenges cross borders, from Africa to the Americas. The dream is for April 11th to become International Safe Motherhood Day, uniting the world in this cause. A global day would put maternal health on the agenda of world leaders and organizations. It would create accountability, encourage sharing of solutions, and mobilize resources. Imagine April 11th celebrated in cities worldwide, amplifying the message for all mothers. India's example shows it's possible. Every mother everywhere deserves the chance to survive and thrive. Safe motherhood is more than a clean delivery room. It starts with comprehensive antenatal care, regular checkups, nutrition counseling, and early detection of risks. Skilled birth attendance is essential for safe deliveries and quick response to complications. Postnatal care in the first 6 weeks is critical for both mother and baby. Many deaths occur after birth. Postnatal checkups save lives. A strong health system connects all these services, ensuring quick referrals and steady supplies. Well-trained healthcare workers are the backbone of safe motherhood. These 4 pillars, antenatal, skilled birth, postnatal care, and a robust health system, must work together. True safety is a continuous circle of care. Safe motherhood is a journey, not just a moment. Nutrition is the foundation of safe motherhood. A mother's diet builds her baby's body and supports her own health. Iron deficiency anemia is a major risk. Iron-rich foods and supplements are vital. Folic acid, calcium, protein, and enough calories are all essential for a healthy pregnancy. Educating families about nutrition turns every meal into an act of protection. Breastfeeding provides perfect nutrition and immunity for newborns. Supporting mothers to breastfeed is crucial for postnatal care. Good nutrition links a mother's health to her child's future. National Safe Motherhood Day highlights the power of food in saving lives. Nourishing mothers means nourishing generations. Safe motherhood is deeply tied to education and women's rights. Educated girls marry later, have healthier pregnancies, and seek care when needed. Family planning empowers women to choose if and when to have children. Access to contraception and information saves lives and prevents complications. Gender inequality and harmful traditions like child marriage put mothers at risk. National Safe Motherhood Day promotes women's rights and challenges discrimination. Education must include respect, shared decision-making, and supportive partnerships. Men play a vital role, supporting, advocating, and sharing responsibilities. Empowered women become active participants in their own health. When women are respected and informed, safe motherhood becomes possible. No country can solve maternal mortality alone. Global collaboration is essential. Governments, organizations, and communities must unite. Wealthier nations should support lower-income countries as an investment in humanity. International organizations set standards, track progress, and coordinate efforts. Local NGOs deliver care and education where it's needed most. Partnerships between funders and grassroots groups ensure effective, sustainable programs. The private sector can innovate, developing health apps, affordable medicines, and supporting initiatives. When all sectors work together, we create a powerful support network. Together, we can build a world where every mother has a chance to live. Safe motherhood needs all of us. You don't have to be a doctor to make a difference. Start by learning and sharing what you know. Use your voice on social media and in your community to raise awareness. Support organizations working to save mothers' lives. Donate, volunteer, or spread the word. Advocate for policies that prioritize maternal health. Write to your leaders and demand action. Every act of kindness, from a meal to a listening ear, supports mothers in your life. Let's build a culture of support and compassion for every mother. See every mother, value her life, and do your part. The journey of motherhood should be safe, dignified, and celebrated. This is a promise we can all make, and it's a promise we must keep.